When people think about supplements, they rarely think about them the way they think about prescription medications. A pill from the pharmacy feels powerful and potentially risky, but a supplement from a health store feels harmless, almost like food. And that assumption is exactly why supplement-medication interactions have become one of the most overlooked dangers in modern healthcare. Many individuals quietly take herbs, vitamins, and extracts alongside their prescriptions without mentioning them to their doctors, believing they don't count as real drugs. But the truth is that supplements can dramatically alter how medications work, sometimes weakening them, sometimes intensifying them, and sometimes creating dangerous or even life-threatening effects. The problem begins with the fact that supplements often impact the same enzymes, receptors, and metabolic pathways that prescription drugs rely on. St. John's wort is one of the most infamous examples. Marketed as a natural mood booster, it induces certain liver enzymes, specifically CYP3A4, that metabolize many medications. When someone takes St. John's wort alongside a prescription drug, it can cause the medication to break down too quickly, leaving insufficient levels in the bloodstream. This isn't a minor issue. It can cause birth control pills to fail, leading to unplanned pregnancy. It can reduce the effectiveness of antidepressants, worsening anxiety or depression. It can interfere with HIV medications, transplant anti-rejection drugs, blood thinners, and countless others. And yet many users take it freely, unaware that this one herb can undermine some of the most critical medications in modern medicine. Another dangerous interaction involves vitamin K, often taken casually as part of a multivitamin or leafy green extract. Vitamin K directly counteracts the effect of warfarin, a commonly prescribed blood thinner given to prevent clots, strokes, or pulmonary embolisms. Even small changes in vitamin K intake can destabilize warfarin levels, pushing someone into a dangerous zone: too much clotting or too much bleeding. A person who suddenly adds a vitamin K rich supplement can unintentionally undo the protection warfarin provides, leaving them vulnerable to life-threatening clotting events. On the other hand, if they rapidly reduce their vitamin K intake, they can end up over-anticoagulated and at risk of internal bleeding. Doctors monitor warfarin patients obsessively for this reason, but all of that careful monitoring becomes useless if the patient secretly introduces new supplements without telling anyone. Even seemingly harmless vitamins can cause serious interactions. Vitamin E, for example, has blood-thinning properties that can amplify the effects of anticoagulant medications. High-dose vitamin C can interfere with certain chemotherapy drugs. Calcium supplements can bind to thyroid medication like levothyroxine, preventing it from being absorbed and leaving patients hypothyroid despite taking their pills faithfully. Magnesium can interfere with antibiotics such as tetracyclines and fluoroquinolones, making them far less effective and contributing to treatment failure. Herbal supplements are even more unpredictable. Ginkgo biloba, often taken for memory, can increase bleeding risk when combined with blood thinners like warfarin, apixaban, or aspirin. Ginseng can disrupt blood sugar levels, a dangerous combination for people taking diabetes medications. Kava and valerian, marketed for relaxation or sleep, can dangerously enhance the sedative effects of anti-anxiety drugs, sleep medications, and alcohol, causing extreme drowsiness, slowed breathing, or impaired coordination. Even grapefruit extract, a common ingredient in natural detox blends, can inhibit the enzymes that break down cholesterol medications, blood pressure drugs, and psychiatric medications, causing unexpectedly high levels of those drugs to accumulate in the body. The danger becomes even worse when people take multiple supplements at once, a common trend in wellness culture. Someone may be taking ashwagandha for stress, turmeric for inflammation, a multivitamin for general health, magnesium for sleep, and a high-dose antioxidant blend, all while also taking prescriptions for blood pressure, thyroid issues, diabetes, or mood disorders. The combined chemical load can shift how medications are absorbed, metabolized, and excreted. And because supplements vary in potency from brand to brand and often contain unlabeled compounds, doctors can't easily predict how they will interact. A patient might present with strange symptoms: dizziness, bleeding, swelling, liver abnormalities, irregular heartbeat, and neither the patient nor the doctor immediately suspects that the cause is a supplement purchased online. This is why it is absolutely critical that patients tell their doctors about every supplement they take, even if it feels insignificant. Many people hide their supplement use because they fear judgment or assume their doctor won't care. but withholding that information puts them directly at risk. Doctors cannot prevent interactions they don't know exist. They cannot adjust medication doses, monitor blood levels, or warn patients about risks unless they have a complete picture of what the patient is taking. The healthcare system is built on precision, dosage, timing, metabolic pathways, therapeutic ranges. Supplements disrupt that precision. They introduce variables that can transform safe medications into dangerous ones or render life-saving treatments ineffective. And because supplements are not regulated with the same rigor as prescription drugs, their interactions are often harder to predict, making full transparency even more important. The bottom line is that supplements are not harmless extras. They are biologically active substances that can change how the body responds to prescription medications in powerful and sometimes hazardous ways. Anyone taking prescriptions, whether for heart disease, mental health, autoimmune conditions, diabetes, or hormone disorders, must treat supplements with the same seriousness as medication and must involve their clinician in every decision. Ignoring this simple step can lead to consequences far more severe than most people realize.